It's an honor and a privilege, Dr. Spira, Mel, to interview you today. When and where were you born?
Born in Chicago, a few miles away from here, July 3rd, 1925, and that makes me 89.
Fantastic. Well, I've been talking to you and you sound great to me. Your parents' names?
My father was Samuel Spira. He was a dentist, practiced here in Chicago. And my mother was Jessie Tiven, and she came from Russia.
Okay. And so your father was a first generation born in America?
He was
then?
born here.
Okay, okay. And how many children, grandchildren, and great-grandchildren?
I had 3 children, 2 girls and a boy, and I have no great-grandchildren yet, but I have 5 grandchildren, and all are doing very, very well, thank God.
And you'd mentioned that your daughters are all doctors.
Well, my oldest daughter, Mary Ann, is a graduate of Yale University. She went to Baylor Medical School. She trained in internal medicine at Beth Israel, Deaconess Hospital in Boston. Got her boards in internal medicine and then went into radiation oncology, went back to Harvard, Mass General for 3 more years, and ended up professor of radiation oncology at UCSD. And my other daughter, Pam, went to Stanford, became a professional show dancer. She was also a gymnast. And but after 3 years, she decided to go back to Stanford, got her MBA, and then ended up a vice president of Goldman Sachs.
Oh, that's right. Okay. I know that your wife had passed away, but how did you meet your wife?
I met my wife when I was a freshman in medical school. This was actually a few years after I graduated dental school. In Augusta, Georgia. I was a freshman at the Medical College of Georgia, which is the University of Georgia Medical School. One of the young women that I knew there said, "You would like to meet Rita Silver. Let me arrange a blind date for you." And I said, "Well, gee, I'd like to see a picture of her." And of course, she showed me this picture of my future wife in a bathing suit at Savannah Beach, and I said, "Boy, I'd like to meet her." And then she comes back and says, "Well, Rita says she has to see a picture of you and before she'll date you." And so I pulled out a picture of myself as a lieutenant junior grade Navy officer, taken aboard the Leyte a couple of years before, and she saw the picture, the white uniform, the epaulets, and she said, "Okay, let's date." And we dated. We married about a year later, and began our life in Augusta, Georgia.
Wonderful. And the rest is history, as we say. What inspired you to go into plastic surgery, and if you could tell us also about your mentors?
Okay. Actually, as you know, I had a dental degree from Northwestern University, and I practiced dentistry for a couple of years with my father, who was a practicing dentist downtown in the Loop here in Chicago. And I got interested in oral surgery after a 2-year stint in the Navy, 48, 49, and 50. I went back and got a master's degree in oral surgery. But I realized, David, at that time at least, that the oral surgeons could do very little outside the mouth, and I really wanted to do major surgery, and decided to at least try to go back to medical school, get an MD degree. Actually, one of the individuals who was my sort of inspiration was Bernie Sarnett. Now, Bernie was the brother of a cousin through marriage. I've known him, or he's known me, since I was a little boy. And he had his MD first, was the plastic surgeon who practiced in St. Louis, founder of the American
Barrett Brown?
No, before him.
Blair.
Vilray Blair. Vilray Blair was the professor there, and took Bernie Sarnett under his wing. Bernie elected to go back to University of Illinois, got a dental degree, one of the few that had his MD first, then a dental degree. And he was sort of my inspiration. He was very heavy on research, particularly craniofacial problems, and he was one of my mentors. I had dinner with he and his wife, Rhoda, when he was 99 years old in Los Angeles, about a year before he died.
Wow.
At any rate, those were was my inspiration. My mentors, gosh, I must say that the individuals who were involved in my teaching me when I was a resident in plastic surgery at Baylor were my mentors. Baron Hardy, the first one. Then there was Tom Cronin, Ray Brower, Romney Freeman, Bob Wise.
Yeah.
And then my future boss was Mike DeBakey, the very famous heart surgeon, for the 20 years that I was professor and head of the Division of Plastic Surgery. Interestingly enough, DeBakey was wonderful to me. You cannot believe that when I operated on one of his, or several of his patients, my first assistant was Dr. Michael DeBakey. Anyhow, that was a long time ago.
That's great. Okay.
So those were some of my mentors.
Well, Texas was, and we're going. In fact, let's get into that now because that's an epicenter. I don't care if you're California, Florida. I'm sorry, and I'm from Maryland, but Texas and Houston was the epicenter of the growth of our profession. And we talked a little bit about breast implants, and you were there, as I said, at the big bang of breast implants. But you would just talk about that a little bit.
Well, the initial credit must be given to Frank Giroux, who was a superb plastic surgeon. He was my junior resident, and he stayed on faculty. And actually, as the story goes, he was pumping blood into a patient in another procedure, and the Dr. Giroux noted that the feel of the silicone bag was very much like a breast. And so he got the idea that maybe we could develop an implant out of this. He talked to Tom Cronin, who supported research there, and both he and Tom went up to Midland, Michigan, visited with Dow Corning, and it ended up they developed the first breast implant. But how we put the first breast implant into a patient is another part of the story, David. The patient that we chose actually allowed us to do it because we had taken tattoos off her breasts successfully using a dermatome, and she was so grateful for the success of the tattoo removal that she said, I will be happy to be the first patient to have the silicone breast implant. What is fascinating to see is that that same patient was seen by me 30 years later, and she, to my best of my knowledge, is alive today. She had the first breast implant put in. The individuals who were in the operating, Tom Cronin, Frank Giroux, Monkey Barton, have all passed away. Tom Biggs and I were involved somewhat peripherally, but it's fascinating to see how breast implant surgery, in fact, breast surgery, has grown, within the profession over these years.
Well, I thank Hugh Hefner for that.
That's right.
It's because until that time, seriously, I think that's when the breast implants became so popular.
Yes.
But that's how.
Well, we used to use breast implants before the silicone implants were put in. They were, I believe, made of polyethylene or polyvinyl sponge, and they looked pretty good. However, they became hard as a rock and were extremely disappointing to most women and to all plastic surgeons.
Yes, and I've actually had to take out a couple that we talked about. They were like taking out a hardball.
Right.
But those were the pre silicones. Okay, let's see. What momentous and paradigm shifts in plastic surgery have you seen during your career?
David, there have been so many, it would be hard to enumerate them all. Let's mention one of them that I think is very important, and that is the fact that when I started in plastic surgery, we did everything. We did the hand surgery. We did the eyelid surgery. I done a number of ptosis repairs. We did the hypospadias repairs. We did the, of course, the reconstructive surgery was done by, ablative surgery and reconstructive surgery was done by plastic surgeons. Look at dermatology. We used to do so many skin cancers and other skin problems, and dermatologists have taken over a good part of that. So it has changed a lot. It's changed in many ways. I think another change, I know the another change, is that the quality of the residents. You and I go back a number of years, but I think they've improved. I'm so pleased to see many of the residents of such high quality, and I believe they're all going to be future contributors to plastic surgery. What has changed? Look at the utilization of the endoscope in plastic surgery. Look at lipoplasty, what we're doing with fat sectioning. Look at the numbers of plastic surgeons that have increased. It used to be there were a few plastic surgeons that were trained and came out each year. It used to be that we'd say, well, you have to have a town of 75 to 100,000
That's right.
in order to have a successful practice. Wrong. We see plastic surgeons, several in towns of that size, and all doing well. So yes, it has changed a lot. Look at craniofacial surgery. There was hardly any craniofacial surgery before Paul Tessier. Look at the utilization, and this has been pushed by Rod Roark, who's done a great job as editor of the American Journal of Plastic Surgery. The utilization of evidence-based medicine, evidence-based surgery is so important. We don't see those anecdotal stories anymore. We see real science, even in our clinical manuscripts that we receive and that are published. So yes, there's been an incredible paradigm shift, if you will, in plastic surgery. The other thing that I must say is that the utilization of microsurgical techniques, microvascular, microneural techniques, has totally changed plastic surgery, the reconstructive portion of plastic surgery. It's just absolutely amazing. But we've introduced so many other techniques. Look at skin expansion. Look at negative-based therapy for wound healing. Look at the role we've had in bariatric surgery together with general surgeons. And you mentioned stem cell therapy. Incredible. There was no stem cell therapy 40, 50 years ago.
Right.
And look what it's done today. Look at breast surgery. David, I'll never forget the time that Ralph Millard, who was a superb plastic surgeon, and incidentally, the first Baylor resident, presented a case of breast reconstruction in which he went through almost 12 or 13 operations with the patient, got a beautiful result, but the morbidity associated with breast reconstruction has been incredibly reduced, and everything has really been amazing when you realize that this concept of medical knowledge doubles every 5 years or so. It has certainly happened in plastic surgery.
I agree. What do you think the greatest mistake we've made as a specialty is?
Well, my honest opinion, that's what you're getting now, is that I think advertising was a big mistake. You know, before 1975, when the Federal Trade Commission threatened to push hard against physicians because of restraint of trade, and they threatened lawsuits, and the AMA finally gave in and permitted advertising. But you know, from going back over 120 years, there was no advertising. You could put the name, your specialty, your address, your phone number, your hours. You could publish them, whatever, but you couldn't show before and after pictures. And it's interesting how advertising has become patient education and other names for it, but the truth of the matter is it's still advertising. So in my opinion, again, that is the single greatest mistake we made in fact, all physicians made in our specialties.
Yes. What do you feel is your greatest professional accomplishment?
My greatest professional accomplishment has been in the area of teaching. I have been personally involved and responsible for the training of about 70 different plastic surgery residents at Baylor College of Medicine. And I have been so pleased to be honored with the privilege of training our future leaders. My professional accomplishments, well, I'll tell you, I've been president of the American Association of Plastic Surgeons. That was a big accomplishment. I've been chairman of the American Board of Plastic Surgery. That was a big accomplishment. I've been president of the American Society of Maxillofacial Surgeons. So I've been very fortunate, David, to be involved not only in the teaching of plastic surgery and the delivery of plastic surgical health care, but also in the organizational in the plastic surgery.
What has been your greatest joy?
Well, my greatest joy, you have to divide that up into two areas. One is my personal family joys that I have been privileged to be with all these many, many years. My grandchildren. If you were to ask me what brought me the greatest happiness, well, I often tell my residents about this Chinese proverb that I heard many years ago. And it goes like this, if I may be permitted to tell it to this audience. If you want to be happy for an hour, you take a nap. If you want to be happy for a day, you go fishing. If you want to be happy for a month, and my wife didn't like this, you get married. And if you want to be happy, if you want to be happy for a year, you inherit a fortune. However, if you want to be happy every day, the rest of your life, you love your work. And I've been privileged to love my work.
Well, we will end up with that thought, not now, because I want to ask you some other things, but that's a common theme that comes to every plastic surgeon that I've talked to, not just this, any plastic surgeon.
But I must say, David, that another joy I've had has been my overseas work, my surgical mission work. And I began that over 20 years ago with Don Laub, with the Interplast, and I worked with Operation Smile. I worked with Rotoplast. I'm now with a group called Surgicore, and for the last 4 or 5 years I've traveled to Africa. I've been to Vietnam. In fact, I'm going back to Vietnam in 3 weeks.
Wonderful, wonderful. I missed this one, but it was your greatest professional disappointment.
I would say that my greatest professional disappointment would be that I've helped train many, many plastic surgeons, and very few have gone into academic surgery. Unlike Jack Hoops, you just interviewed, and Milt Edgerton, who's trained many individuals who have entered and have contributed to the teaching of plastic surgeons. Many of my residents have become chiefs of the individual hospitals in the cities that they practice in, but very few have become head of divisions or departments of plastic surgery. One of the individual students that I really didn't train, but I worked with, was Rod Roark. In fact, he and I helped write his first paper together.
Wow.
When he was a medical student at Baylor.
I didn't realize you went to Baylor, but now I've learned something else. Who do you admire most, professional or personal?
Gosh.
I know that, just
David,
pick a few.
There's so many.
It's not a fair question, but I'm asking it anyway.
The individual that I admire the most, of course, on a personal basis, is my mother, who really pushed me hard, and to whom I owe an incredible amount of gratitude for steering me in the right direction. She was the one that followed the dictum pretty well that the professional person has no right to be other than a continuous student. My travel club group, they've been wonderful. I have admired them. Joshua Kawich, Bill Grab, Jim Smith, Paul Weeks, J.B. Lynch, mentioned Jack. They've been just terrific. Jerry Bain was one of the originators. He was the first chief at Charlottesville. And Ian Jackson, great surgeon. And it's a pleasure, and I've been delighted to be associated with this group. We recently had our, I think, 48th year where we met. I've often been asked what has kept us together, and I can tell you, it's the wives. The wives got along together, and we've met over these years. I think of Bob Goldwood as one of my most admired plastic surgeons. I knew Joe Murray, a Nobel Prize winner, but I must say that, and I knew Paul Tessier, and of course Ralph Millard, Harry Bunke, Milt Edgerton. I must say that Mike DeBakey is one of my most admired individuals. He was an incredible contributor. You know, he has written or co-authored over 3,000 papers, several books. He's trained hundreds of surgeons, and he was one of the individuals that I admired incredibly. But anyway, those are a few. Barrett Brown, another one, great surgeon.
Right. You've named a bunch of icons there.
And of course, I would be remiss if I didn't mention the presidents of the American Association, all of whom have been so friendly to me and with me. I followed Jack Hoops, and I think I followed Paul Weeks. And he followed Jack Hoops, and we sort of went along the line.
Quite
together.
the legacy.
Right.
Okay, I'd like to know your words of wisdom for future or present and future generations of surgeons.
Okay, words of wisdom. No, that's fine. Well, I think the greatest advice I can give a young plastic surgeon, and it was, my mother and I had discussed this, but it was really originated by G.V. Black, who's the father of modern dentistry and the first dean at Northwestern University Dental School. And that was, the professional man has no right to be other than a continuous student. He must study the rest of his life if he's going to be true to his profession. I know that teaching has been a great joy and a privilege in my own life, and I would hope it will affect others. There's no question in my mind, as a teacher, I have learned from my students. You know, Tom Krizik, whom I admired greatly, told me that his greatest joy is when he is doing a reconstructive surgery and he marks out a line where a flap is going to be, and the resident working with him says, well, Dr. Krizik, why not change it to this line here? And he looks at it and he says, you know, you're right. When the pupil exceeds the master, that is a great joy, David, just a great joy. Advice, become active in surgical missions early in life. I waited until I was almost 60 before I went, and I've had the travel club has been another great advice that I can give young surgeons. We've pushed each other, we've helped each other, we visited each other's institutions, we learned from each other. It's always been a delight. The other thing that I would say is good in terms of advice is take the opportunity to attend as many symposiums, as many meetings you possibly can. You may not learn a lot at each one, but I can tell you, if you learn just a little, it'll be worthwhile. I also feel very strongly that if the opportunity arises, visit other plastic surgeons. When microsurgery first came out, David, I went to Australia and worked with Bernie O'Brien. I went to Japan and worked with Gitaro Omori and Dr. Harry. It was an effort, and it took a lot out of me, but it was worth it. So these are a few of the bits of advice I can give.
I think it's
but
great.
above all, educate yourself continuously. That's so important. You know, I might say there is another little thing that I've advised many surgeons to do, and that is keep a good book. Now, many of you don't know what a good book is, but a good book began in 1963 when I received a beautiful letter from a nun whose family I had worked on. And of course, in those days, we never charged the clergy. God forbid you should even think about that. It was an honor to be able to be a privilege not only to the clergy, but also to other physicians. At any rate, she wrote me this beautiful letter, and the secretary at that time said, let's keep this letter aside because it's so beautiful. And from that time on, I've saved all the letters that patients have written me. And now it goes through about 6 volumes.
Wow.
And it's really a delight. Now, I would ask you this question, David. Who has read all those letters? Every one of them, probably several times.
You?
No, my mother.
Ah.
When I was in Houston, she would come down from Chicago, where she lived after my father passed, and she would say, Melvin, I want to go to the office. I would say, Mother, I'm operating today. I'm not going to be in the office. She said, oh, that's okay, she said. And I just want to go there and sit in your office. And as soon as she would come in, my secretary would pull out the books, and David, she would sit there and cry, you know. Mm-hmm. So she really appreciated those letters. I'm going to save the letters. They're going in the Baylor archives. In fact, the originals may go to the Conway Library at Harvard.
Yeah, better than reality TV.
Oh yes, oh yes. Some of the stories you would not believe, David.
Well, that's that. Right. Well, thank God you're going to save those. Okay, words of wisdom for retirement. Okay. I already see just how active you are, so this won't be a big segue here.
I would advise everyone to keep active. You know, if you don't use it, you're going to lose it. And I took up bridge when I was almost 80 years old. I exercise. I watched my diet. I'm almost the same weight I was 50 years ago, although I've gained a little bit since I've been in this retirement home. I advise everyone, I love bridge, as I mentioned. I'm still a little active in Toastmasters. When I lived in Aspen, or Snowmass Village, I was very active in the Aspen Ideas Festival, the Aspen Institute, and of course, surgical missions. And again, I go with Surgicorps group out of Pittsburgh, run by Jack Demas, and it's been wonderful. My next trip will be to Saigon. I'll be going there for the 4th time.
I have to say the testament in this interview is that I was in Houston in 1975, mm-hmm. and I recognized you, and I hadn't seen you since '75 because I had gone up to Ohio or whatever. Yeah. But I immediately recognized. So whatever you're doing, you look fantastic. So for words of future plastic surgeons about retiring, is you can't retire. You can never retire.
That's right.
You have to keep doing something. It's just different.
I must tell you that I think about the future, even at 89. We're becoming a nation, a world of older people. A baby girl born today, David, a baby girl born today, half will live to be 100. And by the way, only about 30% of the men will. But we're going to become a nation where appearance is going to be so important. It's important now, and it'll be even more important later on. I think we can look at a situation in the future where more plastic surgeons get together in groups rather than in single solitary practices. I know that we're going to see much greater contributions by plastic surgeons from other countries. Just look at our journal and you can see who's publishing in excellent articles, well written, and it's obvious that they're making incredible progress. So I'm very positive, very optimistic about the future.
And you answered the last question. I want to ask you, Mel, Dr. Spira, if there's anything else you'd like to say before I conclude the interview.
Yes, there is, David. People say, well, what did you do right in plastic surgery? And I've mentioned a few things. And they say, well, Dr. Spira, what did you do wrong in plastic surgery? And my answer is, I didn't spend enough time with my family. It was a tragedy when my son was lost, but I can tell you that I was so busy in my practice. I must tell you a little, sort of a joke. One day, I came home it was about 7:30 at night. I didn't have the key to the back door of my garage, and I knocked on my door, and lo and behold, my wife opens it, and she looks at me, she says, "Oh my God, shall I call an ambulance?" And I says, "Rita, what's wrong?" "I'm not sick." She says, "You mean you're not dreadfully ill? It's 7:30 and you're home for dinner?" I can't believe it. At any rate, no, I'm very positive about the future. I will talk sometimes to groups, even now, David, about the nuances of my practice. I had a successful practice. I was seeing, at the height of the practice, over 800 new patients a year. Wow. And it was too much, but I had certain nuances, and I'm going to give them, hopefully, with the residents meet at our alumni meeting, which will be tomorrow night. We'll talk about that. But at any rate, it's been a delight being here, David, and I can assure you that my love for organized plastic surgery will always be there. I'm very grateful to the opportunities afforded me by the American Association of Plastic Surgeons, particularly seeing you again in this interview.
Well, I want to tell you it's been an honor and a privilege and to interview you as part of our Icon project. And you had a lot of great things to say and inspired me again. And this will be preserved for generations of plastic surgeons, what you've done. And thank you so much.